So, back in mid-January or so, we kind of had a firing shot, a warning shot.
Right before all of this craziness, kids were on their way out for spring break, so everybody likes to get checked up before they leave. We were super, super busy.
Well, I guess I started to see photos and hear about Italy and understanding if he's probably heading here soon after that.
My nurse manager, Cheryl, came into our bullpen and she said, okay, we're gonna have to start canceling all of our patients. That's when I was like, oh my gosh, like it really hit me at that moment that, wow, this is changing, this is happening. And then the second time it hit me was when, staff have been getting sick.
We started getting more positive patients. They started locking down the building.
We were told that Yale was going to close down. Students were not going to come back after spring break, but we were all still to report to work because we are essential employees. That was a Monday when we all came in, and about 11:45, we got a phone call that they were sending us all of the clinical receptionists home. So I think for me, that's when it became real.
I think it drastically changed when I heard that we will have to set up an overflow space to handle the surge of patients.
Every single day was changing.
We didn't have enough time.
When we started talking about who we were going to train for personal protective equipment, we were going to be pretty much living here for a couple of weeks because we needed to make sure that all the staff's day, evening, overnight staff got trained.
The big aha moment for me was when the CDC posted a big news break that people need to start prepping for childcare. People need to start having a second plan in place. When CDC releases something like that, it's only going to be a matter of time.
We were just talking yesterday, how are we going to ever go back to what we were doing before this? We would have project managers and analysts, and we would be looking at data and talking about it, et cetera, for weeks before we even started. We do these things now in like 24 hours, we open up 500 beds. We literally stood up a 75-bed field hospital in good 3 to 4 weeks.
The Landman Center was not set up optimally for anything. We did the walkthrough and I was like talking to my IT partners and saying, I'm not really sure how we are going to get this all done. Everyone came together, rolled up their sleeves, jumped in and did everything they could do.
We had to take an inventory of what we already had, make a list of everything we were missing for any kind of respiratory illness.
Robin Soltis in our finance department, all she does all day is hunt for equipment and masks. We're reaching out to people from China, from New York celebrities.
Like I came to work dressed in my black pants and dress shoes and was asked to go to Landman and unload boxes and load carts with, supplies that were going to be needed, and without hesitation went. And I stood at the top of the stairs and I looked down and I was like, it's amazing.
So the hotline was definitely something that was needed from the get-go. Originally, it was supposed to just be like an informational hotline. It quickly turned into a full-on nurse triage hotline.
I get a call from a call center manager at 10 a.m. and she said, we really want this set up by the end of the day. And I'm like, we don't have any additional data lines to support all the 25 phones that we wanted. And for a programmer to come in and move PCs, it was a different experience for them.
It's been this collective effort, Stephanie Arliss-Mayer and Matt Lynch, my colleagues from athletic medicine, helping to design workflows for, okay, how are we going to evaluate this person over the telephone? When do we decide when a patient needs to be seen in person? So, many healthcare workers have been asked to take up work that was not in their bailiwick.
Yeah, I think we're definitely helping people be less scared. There is so much nonsense out there. People will call and be like, I saw on Facebook, and you're like, okay, listen, this is what we really do know.
This is a healthcare crisis. So it's stepping into it every day and trying to do the best job that we can.
There was so much uncertainty, and we wanted to give the right information. That was so important because we knew that patients were calling and they were anxious, and As a nurse, you're used to having that information to give that to patients and give them reassurance and education.
If someone's having a fever and cough and wheezing, we're presuming they have COVID-19 until proven otherwise. What's great here at Yale Health is that we have so many good minds. My colleague Tariana, who's a medical assistant, and the nurses looking at this situation from different angles.
I have to have this conversation with my husband saying that, I'm not a frontline staff, but nonetheless, I have to be there to support the technology operations.
It's been amazing how the teams have come together with mutual respect for each other's roles.
I think it's really good to see how well we take care of each other.
Everything is a thank you. Everything is like, Tariana, I appreciate what you did. Tariana, thank you for this. Tariana, thank you for that. And we are like a family, so they are like my family.
You're seeing the healthcare professions on the front line more. That's who's photographed, but it really is everyone who's keeping us safe.
When some of the clinicians are seeing patients for COVID-19, we've been going and dressing the clinicians and making sure that they stay safe, and they're very, very appreciative, and it makes you feel good and you're part of the team.
It's just kind of brought Yale Health together as a whole, having to work together, having to, work for departments we've never worked for.
People are willing to rotate in and out to protect each other from exposure and share the load.
We still need to see our patients for some prenatal care, so we might do a brief visit one-on-one, make sure the baby is okay and do the exam as needed, but spend more time on the telephone.
It's difficult because all of us like to see our patients. It takes a new set of listening skills in order to assess patients now.
I have to interact with them in a way not to make them feel uncomfortable, to let them know that, even though this is going on, but we are still here to take care of them and help them feel safe.
With the telemedicine, with patients away, we're having to find other ways for them to access their medications. It's been interesting to hear them, hear their stories, hear their worries, and try to give them good information and more phone calls, more volume, more prescriptions. It's all right, though.
When you get these challenges in front of you, can't wait to just take that on and move forward with it and learn from it. It's like a challenge that you just are ready to tackle. Am I constantly worried, oh my goodness, am I gonna bring something home? Yeah, you always worry about that. I'm more afraid for patients. That's where my fear goes to, not myself, which I think is an issue with healthcare. You put others first.
My wife and I have had conversations, like I think most people do, certainly people who are parents of contingency plans.
It's uncomfortable because we don't know what's around the corner. It's all new territory.
I have a high-risk spouse. When it really hit me that I was a real threat to him, being in a healthcare facility every day, still coming into contact with patients, not knowing who's sick potentially and who's not, he actually decided we need to really, really separate.
No one really expected this. And it just gives you pause to appreciate the small things in life.
I just take it one day at a time, and I come here, I do what I have to do. And, I pray to God that I don't bring anything home.
People need us. So I'm, with nurses and doctors and administrators and directors, I'm willing to do whatever it takes, to keep everyone safe and healthy. Whether it's scary or not, that's what healthcare workers do.
For me, the upside here is seeing the staff really step up and take leadership roles. Well, it's been a good opportunity and good experience.
Being asked to help at Landman was, another way of me being able to show that I am able to do a lot more.
What I'm looking forward to most, I would like to have dinner with my mom again.
Oh, I really missed my coffee. I am getting my coffee at the cafe.
Do this little dance at the video Xbox thing that I don't know how to do it. It's just my daughter knows. That's what I miss, family time.
My grays are coming in quite fast now, so I'd really like to get my hair dyed soon.
Read a magazine.
I'm gonna be looking forward to seeing my kids.
I wanna hug someone. I just wanna hug somebody. I really do. And I'm not a hugger.
I realize I really like to be in the company of the people I care about. Then, of course, going to a restaurant.
I miss the big Sunday dinners.
Getting tired of Zooming.
I don't know what it looks like after. I don't know, going back to what we were doing, how important those things will still be, or how our priorities will change, how we will work. Will we work differently? I can't say.
And the inconveniences as stores being closed and whatnot, that's very temporal and peripheral, and that will be time limited. So we just need to adjust and be thankful for what we do have.
Not taking life so much for granted.
It's nice having everyone home. We're spending more time together. I'm having the family meals that we didn't used to have because everybody was running around doing something else.
Here I am. I'm like trying new things. I'm learning new things. I'm doing new things. So that's been the most surprising thing, that the things that I was most afraid of beforehand, I'm able to do now. And I'm capable and I'm strong and I can make it through almost anything, because this is kind of crazy. This is a crazy time, and I'm still here. I'm still going to work. I'm still smiling. Like, that's a really positive thing that we're taking away from this.